I was not only grateful to have completed my training some 15 years ago with a tremendous amount of experience, but I was also fortunate to come out of training at a time when great technical advances were being made toward minimally invasive procedures. We've done our best to stay at the forefront of these advances. Women continue to suffer from the same conditions: prolapse, incontinence, the need for hysterectomies or other procedures. However, over time, our approach to correcting these problems has become increasingly less and less invasive. And let me give you a few examples of this. 10 to 15 years ago, when 80% of all hysterectomies were performed through a large incision, requiring 3 or 4 days in the hospital, 6 weeks off of work, we were performing our hysterectomies either partially laparoscopically and or completely vaginal, allowing our patients to go home the next day, back to work in 2 to 3 weeks. And again, this was 15 years ago. So moving forward, we were proud to have been the first in the state to perform total laparoscopic hysterectomies in an outpatient setting, allowing our patients to go home in just a few hours, back to work in 10 to 14 days. Now over 99% of our hysterectomies are performed in this manner. Another example involves how we perform tubal ligations. Tying the tubes traditionally required incisions, anesthesia, recovery. Well, it was a surgery. Now this procedure called Essure has allowed us to tie tubes in a 10-minute in-office procedure. No incisions, no anesthesia, minimal discomfort, and virtually no downtime. We were proud to have been the first in the state to offer Essure as an in-office procedure. That was 10 years ago. Essure is now a standard for permanent sterilization. Another great example involves the treatment of overactive bladder or urgency incontinence. There was a time when all we had to offer these patients were medications that just didn't seem to work very well. Now we have a procedure called InterStim that has drastically improved our ability to treat this condition beyond medications. InterStim is a simple 20-minute procedure which can be performed right here in our facility. Now, while we were not the first in the state to offer InterStim, we are the current #1 provider of this therapy nationwide.